Hi everyone, Christine Moutier from AFSP, and I'm very excited to be doing this live session. And I'm doing it with a team member from Instagram, Dana Geldwart, and I'll just look for her to join here. Let's see, I'm not seeing her just yet. Hi everyone, thank you so much for joining. Thanks for your patience. We're going to be talking about managing our mental health and especially like on social media and just everything that's going on with COVID and the environment that we're in. Oh, I see Dana. Okay, great. I think Dana's going to be joining. Yay. Hi, Dana. Thank you so much for joining. Yay. We connected up.
We made it.
Yes. Thank you so much for joining me.
Of course.
Why don't I introduce myself and then I'll introduce you, Dana. So,
Sounds great.
yes. So I am Dr. Christine Moutier. I am the Chief Medical Officer at the American Foundation for Suicide Prevention. And at AFSP, we like to think of our organization as a science meets grassroots. So we are together in this with literally thousands, probably tens of thousands of volunteers, people who walk in our Out of the Darkness walks, who donate to the cause, and who support one another through our suicide prevention education efforts, through our advocacy efforts, and through our suicide loss and healing programs. So I'm really excited about today's Instagram Live and so thrilled to be joined by Dana Geldwart, who is a manager of policy programs at Instagram, and she specifically focuses on their well-being initiatives. So welcome, Dana.
Thank you so much. And I'm just so grateful for our ongoing partnership with AFSP and with you, Dr. Moutier. You have been such an excellent expert for us to tap into as we develop different policies, technology, and products at Instagram to protect the well-being of our community. So really excited for this conversation. I think it's something that everyone has been thinking about right now. You know, COVID hit, and we at Instagram, we saw people spending more time online and just
Sure.
in front of screens. And so I think how to balance that screen time and ensure that the time you spend is positive and intentional and supporting your well-being is something that's really important to us and important to everyone. I know my friends are constantly asking me for tips on how to do that. So I would love to just start by asking you a few questions, and
Sure.
we want this to be really casual. So for those of you who are joining in, thank you. Please ask any questions that you may, and hopefully we'll be able to get to them at the end of our chat.
Absolutely. That sounds great, Dana. And I'm already seeing our amazing network and individuals chiming in. So thank you so much for your comments, and please keep them coming. We really are in this together, and so happy to see these encouraging comments of, survivors, people who are supporting loved ones, and people who are experiencing grief, and how we can all come together. So yeah, let's get into it. Thanks, Dana.
Let's get into it. And a perfect time for this chat since I know World Mental Health Day is coming up on Saturday, I believe, the 10th, which is just a great time for all of us to reflect on our own mental health and how we can support ourselves and also the people that we care about most. So
Yes.
for those of you who are just joining us, I'm Dana Geldwart. I'm on Instagram's policy programs team focused on well-being, and I'm joined by Dr. Christine Moutier, who is the Chief Medical Officer at AFSP. I'm really curious to hear from you, Dr. Moutier, how people have been using social media to manage their mental health and their well-being during COVID.
Yeah, thanks, Dana. And first of all, call me Christine, please. And I'm also so just grateful for the partnership that we at AFSP have with your team at Instagram,
Thank you.
because it is so important how we all use social media. That is a big part of our lives all the time, but especially during a time like COVID, when one of the ways that we can actually keep safe related to the virus but still stay connected is using technology. And,
Hmm.
I think that what we're seeing is people are using technology a ton more. And so there are sort of like, it's a question of figuring out how do you optimize that for yourself. We did take a poll of the American public recently and found that, it's upwards of 80% are using technology to connect with one another, and an additional like 30% of the general public are using technology for their mental health. So this is
Hmm.
really interesting, using things like apps. Even 26% of the American public right now says they are connecting to a therapist using virtual technology. So that is an incredible statistic. But on social media, what I find, and for me personally, is that you can actually be connected to an incredibly supportive community on Instagram, on other social media platforms, but you do have to still like manage that and kind of figure that piece out, because we all have lots of facets of our life, and really only by being kind of self-reflective and looking at how does this particular thing in my life affect me and my well-being.
Hmm.
And we have to kind of take inventory of that in order to shape what we let into our life. So it's fantastic that Instagram has ways to connect. Obviously, that's the main function, of your work, but that you also are developing ways to try to make sure that people are staying safe, that they have positive ways to connect with each other. I mean, I would love, just to ask you to maybe share a little bit about Instagram's philosophy towards that, and maybe some of the work that you all have been doing.
Yeah, I would love to. Before I get into that, I love what you said about taking inventory of your social media experience. I know for me personally, when I first got onto Instagram, I was following a lot of accounts actually that I don't think really served my well-being. And we like to call it spring cleaning around here, where I actually go in and I've unfollowed accounts that I feel just make me feel bad about myself, or I find that I'm comparing myself to those accounts, and really being intentional about the accounts that I bring into my space. So, who are the voices that I want to see in my feed? Who are the people that I want to connect with? And specifically curating that experience for myself, I know has been really helpful. But at a bigger level, at Instagram, we know that people will only come to our platform and share and express themselves creatively if they feel safe. So, protecting the safety and well being of our community is one of our biggest and most important responsibilities at the company. We work with people like you, Christine, and at other mental health organizations and experts, mental health practitioners. We bring them into the process and bake their feedback into every single thing that we do. So the policies that we're developing to keep people safe, the tools that we're empowering our community with to really control that experience online. And then of course, what I specifically do, which is developing some of these programs where we're going out into communities and helping them understand how to have a really safe and intentional and positive experience on the platform. One of the things actually that we recently developed were Instagram guides, and I know that AFSP has developed quite a few of them. And so I would just love to hear from you about some of the guides that you've put together, and more specifically, one of them I know is focused on the Black community
Yes.
and the intense pressures that certain communities have been feeling during this time. So talk to me about those guides and kind of the thought process of the resources you provided.
Sure. I mean, we at AFSP were incredibly affected, as the world was, by George Floyd's death and the many events that surround that, and the sort of uprising and readiness, the solidarity in the voice of need for change. So we at AFSP have actually been very serious about looking inward and reflecting and realizing the many ways we need to learn. One of the things that we've done is created this guide for mental health for the Black community that really includes resources and learning from the experts within that community and engaging with them. I'm hosting a town hall series. We've done 3 town halls so far, and more to come, where we are elevating their voices and learning from people of color, from their experience, and from mental health practitioners and experts within that community. And of course, other diverse communities as well, other underrepresented, marginalized communities, because one thing that we clearly saw happening when COVID hit is that the sort of underlying health disparities and societal disparities that have been there forever, really, have been just laid bare in a very excruciatingly painful way, in that, for example, 25% of COVID deaths are people of color, Black people, actually, when they, in the whole population, only represent 12.5% of the population. So there is an overrepresentation of COVID mortality. And so this is, this is a big issue of health disparities, and race, ethnicity, education, many things drive that, including economic disparities. And so, the way we look at it at AFSP is anything that puts any of us at risk. And conversely, anything that we can shore up to protect ourselves and gird our protective factors and our mental health resilience. Those are the levers that we want to press on. And so I would point people to our guide for resources for the Black community and their mental health, which again was through an engagement with those experts. And we're very excited to be doing work with them and really making some decisions, again, organizationally. I'll mention one other thing. We have made the decision, our scientific council, to prioritize diversity as a top priority in our research grants program, for example. It's just one example of many to show that we realize that this is an understudied area that needs more attention. So we're really excited. And in fact, next week, Dr. Jill will be hosting the next town hall with researchers from underrepresented backgrounds who do incredible work, and she'll be highlighting their work.
That's so excellent to hear. And I actually just saw a comment come through from Peppermint Mocha 13, love that handle, so good, who mentioned that it can still be really difficult for people to find therapists in their area. So I'm curious if you could answer that, how someone could find a therapist, and then zooming out a little bit, if you know someone who's struggling, how can you support them, whether that's online or offline? What are the different ways, other than connecting them with local resources, that you can really support the people that you love?
Yeah, I mean, finding a therapist or finding a psychiatrist is not always a simple process. But if you think about it, any specialist that you've needed, you have to go through kind of a series of steps to figure out, how do I find the person who's going to be the best suited for what I'm experiencing, maybe my specific needs, either culturally, race, ethnicity, all of those things. And so I would point people to our website, afsp.org, where we have a variety of different ways to search for a mental health practitioner. But we have a treatment finder link. I mentioned the resources for mental health in the Black community, where there are specific therapy and mental health resources for people of color. One of our partners is the National Latino Behavioral Health Association, where they have ways to find treatment for the Latinx community. So this is really, really important. And the biggest message I would give is just don't give up. Just like any other health issue, it's you're going to find someone who has the expertise and can help you, but it can be a process. So kind of steady yourself for some perseverance in the process. And then to your question about what to do if you are worried about someone in your life, I mean, that's a really common experience for all of us. And hopefully we're kind of dialing up our radar to notice when people are showing possible signs of distress, and that we can just through our words, through checking in, using technology, texting, calling them, to really just express that you're concerned and that you want to understand what they're going through and to connect with them if they're willing to. You know, in non-COVID days, I called this the coffee chat, where it can be very informal, but just a real show of support, where you express that this is not because you are judging at all, but because you care about them. You want to help them if there is something going on, but more than anything, you just want to understand what it is that they are experiencing. Just showing that caring curiosity is really the starting place.
I love all of that. And one of the guides that you created is based off of your Real Convo guide, which is taking this idea that everyone can have these real conversations and really breaking it down into actual conversation starters. Because I think a lot of people hear the recommendation, just talk to someone, but that's actually way more complex than it sounds. And the conversation can feel really, really overwhelming. And so what you've done is actually take a lot of those conversation starters and you put it into this place where a lot of young people are spending their time, and did it in a way that's really visual, really creative, and in a way that communicates exactly to how young people are communicating to each other.
We probably should tell people where to find these guides, because I don't want them to be
Great call.
It's a big mystery.
So you can actually find the guides that AFSP has created on their profile. You'll see a little toggle that says guides. I believe they have 3 available, but we developed this product guides to really allow different creators to curate different tips and recommendations, all in one place. And so we did start this off with mental health organizations. And the reason why we did this is because when COVID happened, we realized that there was just such a significant need for people to be connected to resources. And so we worked with groups like AFSP, but other organizations and friends in the space, like the National Alliance for Mental Illness, Active Minds, JED Foundation, where you can all seek out different resources to support your emotional well-being, and share them with friends on Instagram.
Yeah, it's really remarkable that people who may not know, and I wouldn't have known if I hadn't gotten to know you and your team, that your social media platforms seem so corporate and so kind of huge and sterile, but there are actually people in these organizations who care and are seeing what's happening in the community, and I think in a big way feel a sense of social responsibility to use their work and their platform for good whenever it is at all possible. And certainly that's been our experience of working together, Dana. So thank you.
Yeah, of course. I have one more question, and then I'd love to take one more from the comments that I saw come in, which is I'd love to talk about inspiration and just some of the things that you've seen recently, whether on Instagram or otherwise, different accounts that really inspire you or kind of give you a boost of positivity when you need it.
Well, yeah, this is what I'm talking about curating who you follow and who you're connected with on social media. Because honestly, I feel like when I go on my account, the posts that I see are my kids' college-age friends who are talking about their mental health and encouraging others that you don't have to be perfect, that it's about authenticity, it's about progress, not perfection. Those are the messages that come through in different ways, at AFSP National. Our social media staff person, Vera, has found these incredible influencers and
we
artists.
Love Vera.
Yes, shout out for Vera. but who artists who create art and just graphic, visually pleasing designs that also get across those same important messages that really are the opposite of what I think a lot of people are experiencing, like with that comparison game that you mentioned earlier. That
Mm,
is toxic and poisonous to the soul for all of us. And really it is completely like irrational and pointless, but yet it's where our human mind tends to go. And so I think making sure that you are kind of surrounding yourself with a steady dose of these true positive messages that no one can be perfect. So let's just throw that idea out the window. And now let's get real and aim for what we can, which is learning how to manage our own mental health, learning how to support each other in a respectful, sensitive, and appropriate way. That's really what it's about in the mental health and suicide prevention world. And I think where social media can be so incredibly useful.
completely agree. Well, you actually answered the question that I saw come through, which was,
Hmm.
how do we help kids not judge their lives against the filtered view of others' lives that they see presented on social media? Which is kind of fair, right? I mean, my background right now is very aesthetically pleasing. I think I'm a little biased, but like to my left, I have the scraps of my lunch that I haven't yet taken to the sink to clean, and like to my right is a load of laundry that I'm deeply not looking forward to doing. But you don't see it; it's right out of screen. So I know you've touched on this a little bit, but I'm curious if you were having a conversation with your children, who you mentioned are in college, any specific tips that you would provide them to really kind of understand the images that they're seeing, and not to compare their lives to different images that they see.
Yeah, I think about a long time ago when my daughter was maybe 10 or 12. She and I did this we joined this mother-daughter yoga group. It sounds really hokey, but part of what the group would always start with before we got to the yoga was some like presentation that the leader provided about kind of like for girls and young women about their own sense of identity, their own self-image. And one of the
Hmm.
sessions actually showed a model going from like the raw natural state to the highly made up hair and then photoshopped presentation of that picture of that model in a magazine. And it was such a reality check for, well, for me, but certainly for my daughter who was young at the time. And so sometimes the visual is like worth more than anything else. I think there are lots of ways that young people are actively learning and putting out tips about how to manage this very thing, about how to not let it go into a toxic place for your mental health,
Hmm.
for your anxiety, for your self-esteem. It can involve taking breaks from social media. It can involve messaging to your community that you're going to take a whatever it is, 1 week, 2 week, 1 day break in order to kind of reset your baseline well-being. And
Hmm.
even just doing that sends a really powerful message to others that might inspire others to think about doing the same. So there's a whole bunch of kind of like what I would call healthy boundaries tips, and it's actually in some of the Instagram guides and AFSP guides that we've created that give a whole bunch of ideas about how to kind of filter through and get your community on social media to a place that's in a much healthier place.
I would also say there are a ton of tools too that we have within Instagram. One that I use often is Mute. So sometimes when I just need to take a break from someone or an account, I will mute the account for a little bit. And whenever I feel like I'm in a better headspace, I kind of unmute them and things resume as normal. And basically what happens there is that when you mute someone, you just don't see their stories content or their posts and feed. But you can always undo it, and the person is never notified when you add them to be muted. I also use our activity dashboard to kind of shame myself into seeing how much time I'm spending on Instagram. I remember the first time I looked at it, I was anticipating like 15 minutes a day, and it was higher. It was 30 minutes a day. So I set limits for myself. I check in with myself, and that's kind of how I manage that experience online. Well, I know I know we said we would chat for 30 minutes. I feel like I could chat to you forever. Um,
Same, Dana.
I will say we are doing a roundup on the Instagram account, which sounds very meta. But we will be doing a story of a roundup of all of these mental health guides that organizations like AFSP have created on World Mental Health Day. So that'll be going up on Saturday. And so if you're curious to connect with some of these different resources or find different inspiring content and recommendations, please go check it out. It'll be there on Saturday. I think that doorbell was just a package I've been waiting for. I'm very excited about that. I don't know if you heard that. So
A little
definitely
bit, barely.
encourage you to check that out. Christine, any last things that you want to say before we disconnect?
Well, I forgot to share one like personal thing that I'm trying that I just thought could be interesting to try for other people.
Yes.
Um, at bedtime, I am trying to commit to a period of time, like 15 or 30 minutes, when I'm not on my phone right before I go to sleep. And
Oh,
so,
I need to do that.
that you can substitute it with a whole host of really cool things, like just reading a book or doing some breathing exercises, listening to music, talking to your loved one. And similarly, trying not to have screen time be the very first thing that my waking up brain gets exposed to. And so just little things like that that can actually make a big difference, certainly in terms of your sleep with regard to your nighttime routine. But the last thing that I'll say is just that we at AFSP care so much about the entire community and are grateful for our partnership with Instagram and all of the ways that our amazing volunteers are carrying the torch of suicide prevention in their communities day in and day out. Thank you so, so much. Right now during COVID, it is a weird time, but the work continues very strongly thanks to you all. And on all of us kind of keeping up our own mental health as a like fountain and foundation for our own sort of energy and continued motivation for the work. So thank you.
Thank you so much. And keep the conversation going. I think this will be something that is important for all of us to continue to check back in on. And so I'm just really grateful that we were able to share some tips. I'm actually loving a lot of the tips that I'm seeing in the comments right now, just
Awesome.
to support each other and be there for one another. So thank you,
So great.
Christine.
Great. Thanks, Dana. Thanks, everyone.
Bye, everyone.